Hello everyone, welcome to today's video where we're diving deep into a topic that's too often ignored: men's mental health. It's a subject shrouded in stigma, misunderstanding, and silence, yet it affects millions of lives every single day. Today, we're going to unpack the challenges men face, explore the conditions impacting their well-being, and share practical ways to seek help and support. This is a journey of understanding, empathy, and action. So stay with us as we shine a light on this critical issue. Let's get started. Men's mental health is a pressing concern, but it's often overlooked. Nearly 1 in 5 men in the United States lives with a mental health condition, yet many never seek help. Why? Social pressures and expectations play a huge role. Society often tells men to tough it out or hide their emotions. Showing vulnerability is seen as weakness, which creates a barrier to seeking care. This stigma can lead to feelings of shame, isolation, and even denial. Men might feel they need to push through pain rather than address it, and this mindset can have serious consequences. The reluctance to open up doesn't just affect the individual. It impacts families, friendships, and communities. Breaking this silence is the first step toward change, and it starts with understanding the real challenges men face every day. Let's talk about the specific mental health conditions that affect men. Depression is one of the most common, but it looks different in men than in women. About 6.2% of men experience a major depressive episode each year. Unlike women, men might not always show sadness. Instead, they may feel irritable, angry, or turn to substances like alcohol to cope. Anxiety disorders are also prevalent, though diagnosed at half the rate in men compared to women. Men might experience racing thoughts, constant worry, or physical symptoms like a tight chest. Attention deficit hyperactivity disorder. ADHD is another condition where men are diagnosed at nearly twice the rate of women. ADHD can make it hard to focus, stay organized, or control impulses, affecting work and relationships. Substance use disorder is another serious issue, with men developing it at 1.5 to 2.3 times the rate of women. This often stems from using drugs or alcohol to numb emotional pain. Finally, men are more than twice as likely to die by suicide, a heartbreaking statistic that underscores the urgency of addressing these issues. These conditions are real, they're common, and they're treatable, but only if we recognize them. Certain factors increase the likelihood of men developing mental health challenges. Childhood trauma, such as abuse or neglect, can leave lasting scars that manifest in adulthood. Stressful life events like job loss, divorce, or financial struggles can also take a toll. Men in the LGBTQ+ community face unique risks due to societal stigma and discrimination, which can lead to higher rates of anxiety, depression, or suicidal thoughts. Chronic illnesses like heart disease or diabetes can worsen mental health, creating a vicious cycle. Social isolation is another big factor. Men are less likely to build strong support networks or share their struggles with friends. Even cultural expectations, like the pressure to be a provider or appear strong, can weigh heavily. Recognizing these risk factors helps us understand who's most vulnerable and why. It's not about blame. It's about awareness and taking action to support those who need it. Stigma is one of the biggest obstacles to men seeking mental health care. Society often paints men as stoic, self-reliant, and unbreakable. Admitting to struggles can feel like failing to meet those expectations. Many men worry about being judged or seen as less masculine if they seek therapy or medication. This stigma isn't just external, it's internalized. Men might convince themselves they should handle problems alone, which can lead to bottling up emotions until they become overwhelming. The consequences are real. Untreated mental health conditions can lead to broken relationships, job loss, substance abuse, or even suicide. Breaking this stigma starts with changing the conversation. We need to normalize men talking about their feelings, seeking therapy, and prioritizing their mental health. It's not a sign of weakness, it's a sign of strength. So, why do so many men avoid seeking help? It often comes down to a mix of fear, shame, and misunderstanding. Many men believe mental health issues are something they should fix on their own. They might worry about being labeled as crazy or losing respect at work or home. Some don't even recognize their symptoms as mental health issues. They might think feeling angry or tired all the time is just part of life. Others lack access to affordable care or don't know where to start. In some communities, especially among minority groups, cultural beliefs may discourage seeking professional help. For example, men in certain cultures might be taught to rely on family or faith instead of therapy. The result? Over 27 million American adults with mental health conditions go untreated each year. That's a staggering number, and it shows how critical it is to make help accessible and acceptable. Let's explore how men can get help, starting with psychotherapy. Psychotherapy, often called talk therapy, involves working with a trained professional like a psychologist, psychiatrist, or counselor. It's a safe space to explore emotions, thoughts, and behaviors. Cognitive behavioral therapy, CBT, is one of the most effective types. CBT helps identify negative thought patterns and replace them with healthier ones. For example, if a man feels constant self-doubt, CBT can teach him to challenge those thoughts. Other forms, like dialectical behavior therapy, DBT, focus on managing intense emotions and improving relationships. Therapy isn't just for severe issues, it's for anyone who wants to feel better or handle stress. Many platforms like Open Path Therapy Collective offer affordable options, making it easier to get started. The key is finding a therapist you trust, someone who understands your unique challenges. For some men, medication can be a game changer. Antidepressants, like selective serotonin reuptake inhibitors, SSRIs, can help manage depression or anxiety by balancing brain chemicals. For ADHD, stimulants like Adderall, amphetamine, dextroamphetamine, can improve focus and impulse control. Medications are often prescribed by psychiatrists, who are medical doctors trained in mental health. They'll work with you to find the right dose and monitor side effects. Medication isn't a cure-all, it's often most effective when combined with therapy. Some men hesitate to try medication because of stigma or fear of dependency, but when used correctly, it can be safe and effective. Always consult a healthcare provider to discuss what's right for you. The goal is to feel like yourself again, not to change who you are. When therapy and medication aren't enough, neurostimulation can be an option. This involves using devices to send electrical or magnetic signals to specific parts of the brain. Electroconvulsive therapy, ECT, is one example. It's done under anesthesia and is highly effective for severe depression that doesn't respond to other treatments. Another option is transcranial magnetic stimulation, TMS, which uses magnetic pulses to stimulate brain activity. These treatments sound intense, but they're safe and carefully controlled. They're typically used for serious conditions like treatment-resistant depression or bipolar disorder. Neurostimulation isn't the first step. It's for cases where other treatments haven't worked. It's a reminder that there are always options, even when things feel hopeless. Beyond professional treatment, lifestyle changes can make a huge difference. Regular exercise is a powerful tool. Studies show it can reduce symptoms of depression, anxiety, and ADHD. Even a 30-minute walk a few times a week can boost mood and energy. Sleep is another critical factor. Poor sleep can worsen mental health, so aim for 7 to 9 hours a night. Nutrition matters too. Eating balanced meals with plenty of fruits, vegetables, and protein supports brain health. Mindfulness practices, like meditation or deep breathing, can help manage stress. Building a support network is also key. Whether it's joining a men's group, reconnecting with friends, or talking to family, social connection reduces isolation. These changes aren't quick fixes, but they build a strong foundation for mental well-being. If you know a man struggling with his mental health, your support can make a difference. Start by listening without judgment. If he opens up, don't try to fix the problem, just be there. Encourage him to seek professional help, but do it gently. You might say, "I've noticed you seem stressed. Have you thought about talking to someone?" Offer to help find resources, like a therapist or a support group. If he's in crisis, don't hesitate to suggest the 988 Suicide and Crisis Lifeline. Small gestures, like checking in regularly or inviting him to social activities, can help him feel less alone. Supporting someone doesn't mean solving their problems. It means showing them they're not alone in facing them. Men's mental health is a journey, not a destination. It's about recognizing that struggles are normal, seeking help is a sign of strength, and small steps can lead to big changes. Whether it's therapy, medication, lifestyle changes, or simply talking to a friend, there are countless ways to move forward. The key is to start somewhere, anywhere. If you're a man watching this, know that your mental health matters, and you deserve to feel better. If you're here to support someone else, your empathy and encouragement can change a life. Let's keep the conversation going, break the stigma, and build a world where men feel safe to be open and seek help. Thank you so much for joining us on this deep dive into men's mental health. We've covered a lot, from the challenges and conditions to the treatments and support systems that can make a difference. Now, it's time to take action. If this video resonated with you, please like, share, and subscribe to our YouTube channel for more content like this. Drop a comment below, tell us your thoughts, share your story, or let us know what topics you'd like us to cover next. See you soon.